Last question on my agenda that I'd like to present to the candidates. Chris, how would you, as the congressman out of the 32nd District, set forth a tax revenue-based structure as a result of the challenges we have with taxes?
Well, on tax revenue, you already know I'm not real crazy with the present tax code we have. For too long, the IRS has been running and dictating how businesses, both big and small, run. They tell you what is a deduction and what isn't. Like I said, before 1913, we didn't have any of this. And a $600 million surplus back in 1912, let me tell you folks, that was a lot of money back then. So with the tax codes revised or even eliminated, the revenue aspect the businesses will be able to generate won't even be affected by the current tax code, because it'd be my job to either get it greatly reduced or eliminated entirely. Businesses did fine raising revenue and starting up everything prior to that time in our life when we didn't have a tax code. And the revenues now could then be used by the business, their profit. They could reinvest it like they used to. They could do what they wanted with their profits, not wondering how they had to do it. And that's why I firmly support getting rid of our current tax code and let businesses get back to doing business the way it used to be.
Thank you. Betty?
Could you repeat the question?
The question is, how would you, as the Congresswoman from the 32nd District, will work to, one, raise tax revenue to help the district, as well as try and combat the tax raising issues and concerns of the district?
Well, one of the reasons why I decided to run for Congress is because of our tax structure and because of the deficits that are existing. First of all, we have to learn to live within our limits. And that economy needs to be turned around and jobs must be produced, really, before any tax revenues will come in at all. And I also believe that when you stimulate businesses by having a tax structure that is friendly, you will be able to generate more profits from which then you get a smaller percentage of a bigger pot to bring in. I've always taught my children that you don't want 100% of that little small piece of tart that you get for dessert. What you want is just 5% of that big apple pie, because that 5% of that big apple pie is a lot more apple pie than that 100% of that tart. And I think the federal government needs to learn that when you start taking away money from businesses, when you take money away from the pockets of the residents, it does not generate the tax revenue. You generate tax revenues by being partners with them to generate the wealth, to bring the taxes, to be able to provide all sorts of programs. It's very simple, ladies and gentlemen. You must first create the wealth, and you do that by encouraging businesses to be profitable. When you raise the taxes to pay for the millions of individuals who do not have health care, you're driving small businesses to close down. They're closing down already. So let's be practical. Thank you.
Chris, we are going to change the topic to health. What is your position on the federal health care plan?
Well, for the folks that haven't seen me before, I'm the best reason that you need to send me to Congress. I have no health care. What better person to send to Congress than someone that has personal experience on what it's like to be in a living hell of no health care, and to send them there to shake them up and make sure that they do it right and fair and not at a profit. I have type 2 diabetes, and I can't even afford the insurance for that. In fact, most of the companies, they discriminate against you if you have anything. They only want the healthy people to make their money off of. The greed and the high power money that is in the insurance industry has got to go. I'm tired of having people being denied services. My wife is on Medicare through Kaiser, and it's one of the better ones. And let me tell you, if that's one of the better ones, I can only imagine what some people are having to put up with. I'm my wife's caregiver, and I'm not on any union or anything where the government has to pay for it, and I don't want it. That's what you do when your wife of 29 and a half years gets ill. You take care of her, and you do the best you can. But the current system that's there now is no good, and if we can't even fix Medicare, I don't even want to see what they're going to bring up for national health care, because what's it going to do? It's going to come out of your pockets, folks. And I'm had it. You know, the taxpayers have had it. Let the private industry do it. We can do a health care national where they can compete and maybe drive some of those greedy people in the insurance companies to get their rates down to where they should be, or make them more efficient, or not overcharge. But a national health care program, I'm not impressed with the one we got, and I've got to fix that one first, and that's why you got to vote for me on July 14th.
Thank you, Chris. Betty?
I agree with Chris that if we cannot even take care of our Medicare system, we cannot provide adequate medical care for our returning military veterans and their families, we don't want a nationalized health care system. The Ted Kennedy bill gives the money and promotes the insurance business because it requires everyone to have an insurance policy. Why not take that money and make it direct, again, like we should, direct to the people that need the help? We presently have medical clinics. We presently have hospitals. All of that does need to be revised, because what we need is not nationalized health care or universal health care. We need affordable, quality health care. And for those that cannot afford it, then if we do need to provide for the needy, but you don't do it by taking it out of the pockets of our residents and putting it into insurance policies that go to the insurance companies. You provide it by having the medical centers and the hospitals provide better quality care on a basis more in terms of preventative care, so that we do not get to the point where the people are too sick and the expenditures are very costly then to take care of them. In other words, you provide mammograms for the women so that you catch it at an early stage. Diabetes, you catch that at an early stage by having more visits.
Thank you, Betty.
Thank you.
It's a big subject. In 2
Chris.
or 3 minutes, it's hard to get it all in.
Well, we're going to try and keep it narrow so we can get it in and get a couple of more questions out, and then get the audience participation.